Today at ESC in Barcelona, where it's very warm, I presented the results of the AXIOMATIC-SSP trial. This was a phase 2 trial of dose finding for factor XI inhibitor, milvexian, in patients with a recent high-risk TIA or stroke. So essentially what we did was we took patients who were within 48 hours of onset of symptoms of a mild to moderate stroke or high-risk TIA, gave them all dual antiplatelet therapy for 21 days, followed by single antiplatelet therapy to 90 days, and randomized them to one of 5 doses of a factor XI inhibitor, milvexian or placebo. What we found, which is very exciting, was a reduction in the risk of symptomatic stroke at all doses of milvexian, apart from the highest dose, 200 milligrams BID. So starting at 25 milligrams once a day compared to placebo, there's a reduction in symptomatic stroke. Now, this was not our primary endpoint. Our primary endpoint was a composite of symptomatic stroke and covert stroke detected by MRI. The covert stroke on MRI did not show a treatment effect. And I think this is telling us that the mechanisms may be different for those small, deep infarcts and may not be responsive to antithrombotic therapy. Nevertheless, with the effect that we see on symptomatic stroke, which was 30% when the dose was higher than 25 milligrams twice a day, we're very excited with these results and want to move forward to a proof trial, a phase 3 trial, which should be starting shortly. Combined with that signal of efficacy, we did not see a significant increase in intracranial hemorrhage, the most serious type of hemorrhage that we worry about. Most hemorrhages in this trial were mild and easily managed. The most common type of hemorrhage is actually GI hemorrhage, and rates of major hemorrhage range from 0.6% to 1.5%, so relatively low. There wasn't a dose response for hemorrhage, but there was an increased number of hemorrhages at the higher doses after 50 milligrams BID. So overall, the key takeaways are we see an efficacy for symptomatic ischemic stroke without an offsetting increase in intracranial hemorrhage.